Hey everyone, this is Ben with RegisteredNurseRN.com, and in this video I'm going to give you an overview of the nursing profession and talk about the different types of nurses. And a lot of people want to know what are the different types, what are the different areas, and so forth, and that is a great question. It's also kind of a complicated question though, because for example, when someone asks what type of nurse you are, they could be talking about your specialty or your concentration, or they could be talking about your scope of practice. And so, you can be a neonatal nurse and be a registered nurse, or you can be a neonatal nurse and be a nurse practitioner. So it's kind of complicated. So what I'm going to do in this video, I'm going to talk about these types of nurses based on your scope of practice, and I'm going to talk about the different types and the degree requirements, the job overview, and the salary statistics. And then in a video next week, I'll give a quick rundown of the different specialties or concentrations of nursing. And when I mention these salary figures, all these will come from the Bureau of Labor Statistics as of 2014, with the exception of one, which I'll tell you about that when I get there. Okay, so let's talk about, first of all, the non-degree nurses or the entry-level type of nurses. And I'll start way back with nursing assistants. Now, a lot of people will say that nursing assistants or CNAs aren't technically nurses, and in a sense they're right, they're not. But CNAs and nursing assistants are usually overworked and underpaid, and a lot of these individuals go on to make wonderful nurses. They'll go and become LPNs or RNs later on. So it's a great job to work in if you're thinking of becoming a nurse later on, and so let's talk about it. First of all, the average wage per hour is $12.62 or $25,160 per year, according to the BLS. These individuals will feed, bathe, clothe, and groom patients. They'll also change linens on the bed and so forth. So it's a very entry-level type work. And you usually just need a diploma or GED to become a nursing assistant. If you want to become a certified nursing assistant, a CNA, that usually takes about a 3 to 4 month course. And you can take that, you can earn a little bit of a higher income than that figure right there, but that's what's required for that. Next, we have what you might say is the true entry-level type of nursing, which is LPNs, licensed practical nurses, or some people will call them LVNs, which stands for licensed vocational nurses. And again, there's no degree requirement for this. The average hourly wage is $20.87 per hour nationally in the U.S. The average salary, $43,420. And LPNs can make wonderful nurses. My mom was an LPN. My wife's mother was an LPN. And these nurses tend to dress wounds, give enemas, assist with bathing, monitor catheters, and so forth. The scope of practice from state to state is different for all these types of nurses. So what an LPN is allowed to do in my state may be more or less than what an LPN is able to do in your state. So it all just depends on what the State Board of Nursing dictates for all these different types of nurses. But generally speaking, if you want to become an LPN, you have to have a diploma or certificate, and that takes about 12 to 18 months to complete that education requirement. After that, you will sit and take the state board's exam, which is the NCLEX PN exam, and you will become licensed and you can work as an LPN. Next, you have the degree nurse, which is the registered nurse. And registered nurses, according to the Bureau of Labor Statistics, earn an average of $33.55 per hour or $69,790 per year. And they will do tasks like record medical histories, insert catheters, monitor certain vital signs, administer medications, give IVs, injections, and so forth. That's what a registered nurse does, and there's a lot of different specialties out there. And to become a registered nurse, you can either do it one of two ways. You can do an associate's degree or a bachelor's degree. There's also a actual diploma program available for registered nurses, believe it or not. Those aren't quite as common, and usually they're done through an actual hospital program, but the majority of times you can do it through an ADN or BSN program. The ADN takes 2 years, BSN 4 years. Whichever program you decide, and it doesn't matter for the purposes of becoming an RN, you'll then sit for the NCLEX RN exam, and when you pass that, you're licensed to practice as an RN in your state. And we have a video on the difference between ADN and BSN nurses. It's just mostly you want to do a BSN if you plan to get an advanced degree, but if you just want to get in and out and become a nurse as quickly as possible, an associate's degree in nursing is fine. Next, you have the category of advanced practice nurses. These are registered nurses who have gone back and they have got they have received special training and an advanced degree to enlarge their scope of practice, okay? Now, there are 4 different types of advanced practice nurses, or advanced practice registered nurses, some people call them. The first one is the CRNA, the Certified Registered Nurse Anesthetist. And these individuals make $76.40 per hour on average in the United States, or a salary of $158,900. And what they do is they administer anesthesia, they oversee the recovery after an anesthesia has been administered, and they also monitor vital signs of patients. You're going to have a master's degree, which takes about 2 to 3 years, and sit for an examination after that. Next, you have the clinical nurse specialist, and these statistics were not available at the Bureau of Labor Statistics, so I got a couple of median salary numbers from Salary.com. The median salary was $97,661. According to Payscale.com, it was $81,589. Again, the Bureau of Labor Statistics did not have those available. And they focus on the macro level, a big picture of healthcare that covers nurses and nursing facilities, the practice, the patient, the healthcare organization, all of it. They look at it and they see ways to improve it, improve healthcare, improve the health of the individual, and all those things. And again, they're responsible for the diagnosis and treatment of health and illnesses, disease management, health promotion, illness prevention, and all that. And so that's what a clinical nurse specialist does. Next, you have the nurse practitioner. Nurse practitioners earn an average of $41.11 per hour, or $97,990 per year, according to the BLS. And these individuals perform, order, interpret various diagnostic tests. They do have the ability to prescribe medications in most states. And you need a master's degree level education again for this, and you'll have to pass licensing exams. And finally, you have the certified nurse midwife. And the certified nurse midwife earns $46.97 per hour on average, or $97,700 per year on average. And they diagnose and coordinate all the aspects of the birthing process, just like what you would think a midwife would do, right? Now, what's interesting is that according to the AACN and NCSBN organizations, there's actually a push to make all these advanced practice nurses actually require a doctorate degree in order to practice in this advanced state. And they're pushing that, and as of right now, they're requiring that to happen as of 2025. So by 2025, if you want to become a CRNA, nurse practitioner, any of that, you're probably going to have to get a doctorate level degree. As of right now, you can still do it as a master's degree. So if any of you are on the fence about it and you're not sure, you may want to go ahead and do that pretty soon. And like I said, this doesn't really cover specialties. Specialties, all these individuals can specialize in an area. For example, an LPN, you would say maybe my mother had a concentration or a specialty with geriatrics because she worked in a nursing home. And registered nurses can do the same thing. You can be a neonatal nurse as a registered nurse, and also a neonatal nurse as a nurse practitioner. So I'll talk about specialties a little bit in another video. So those are the different types of nurses based on your scope of practice, and a little bit about the degree types. Also, one final thing, as a let's say you want to be a nurse educator. Well, if you want to become a nurse educator, you also have to have a master's, but generally speaking, nurse educators aren't considered advanced practice nurses. You're just an RN who has received additional education so that you can teach. And so that's a little bit about that. So I hope that helps you understand a little bit about the different types of nurses. Thank you so much for watching, and have a great day.